Hello and good afternoon. My name is Dr. Rona Hartzano, and I will be your moderator for today's webinar by Dr. Tomoko Makishima. I am a surgeon scientist at the National Institutes of Deafness and Other Communication Disorders at the Neurology branch. Our presenter is very excited to be here today with us. And Dr. Makishima is an associate professor at the University of Texas Medical Branch, UTMB, Department of Otolaryngology, Head and Neck Surgery on Galveston Island, Texas. She obtained her MD and Ph.D. at Kyushu University in Fukuoka, Japan, studying the molecular mechanism of apoptosis. She then completed residency training in otolaryngology in Japan before coming to the NIDCD NIH as a postdoc in Dr. Andrew Griffith's lab to study genetic hearing loss in humans and in mouse models. She has been at UTMB since 2005 as a clinician-scientist, splitting her efforts between patient care and research. Her research focuses on the molecular mechanisms of hearing imbalance disorders and uses a combination of molecular biology and auditory and vestibular behavioral analysis in human and in mouse models. In recent years, her lab has been tackling various otolaryngologic sequelae of viral infections in collaboration with the Pathology Department and the high containment Galveston National Lab at UTMB. Currently, her lab is working on characterizing hearing loss and balance and dysfunction caused by Lassa virus in mouse models, as well as in human subjects, through collaborations with Jos University, Nigeria. Before getting started today, we would like to review a few meeting tools that you, as an attendee, will be using throughout the presentation. These tools are located on the bottom of your screen. To keep questions from becoming distracting to our presenter, please utilize the chat function directed at myself as a moderator. You're welcome to submit your questions at any time throughout the presentation by typing into the chat function and clicking the send button. Any questions that are not addressed during this session will be answered by the presenter in a follow-up email. Closed captioning for this meeting is available for your use, and this session is being recorded and will be made available for additional viewing. We hope you will participate in our post-webinar evaluation so we can gather feedback. Lastly, if you are having technical difficulty, please email the email that I'm going to put in the chat box that will be able to help you with technical issues. With this, I would like to welcome Dr. Makishima to present her seminar about hearing loss caused by Lassa Fever. Thank you, Tomoko, for presenting.
Thank you, Rona, for the introduction. I have a lot of slides today, so I'm going to go ahead and just start. I'll be talking about hearing loss caused by Lassa fever. I know a lot of you are unfamiliar of what Lassa fever is, so I will be explaining about that first. Oops. Yes. So Lassa fever is an acute hemorrhagic fever that is caused by the Lassa virus. And this disease is endemic to the Western African countries, such as Benin, Ghana, Liberia, and our collaborator, Nigeria. And the infection occurs by direct contact with urine or feces or bodily fluid from the rodent Mastitis natalensis. And the reason why it's limited to this area is because this species of rat only lives in this area of Africa. The fatality rate of this hemorrhagic fever is about 1%, and you will see up to about 400,000 cases per year just in this region. So you can say that this is a pretty prominent disease and a health issue in this part of the country. The treatment for this viral infection, it is told that ribavirin is effective to a certain point, but it's not effective to the point where it will cure the disease. And what's very interesting to us as an otolaryngologist is that the 25% of the survivors will develop hearing loss afterwards. The incubation time of Lassa fever is about 6 to 21 days. The symptoms really varies between person to person, just like COVID does. And it's usually asymptomatic in most patients, in about 80%. But the variation can come from cold-like symptoms all the way up to severe hemorrhagic fever and death. If death occurs in severe cases, it's usually within 14 days. There are several different diagnostic methods that they use in this region. And the antiviral ribavirin is effective, but you have to be careful because it's only effective if it's given at early stages, like within 5 days. The problem with this disease is that because it is very similar to more prominent diseases such as malaria, it's often mistaken as malaria and diagnosis is delayed. There is no vaccine for this disease. And again, what is very interesting to us is that the survivors of this disease, in about 25% to up to about 1/3, will develop sudden onset severe hearing loss in the convalescent phase after they clear the acute disease. Now, if you think about another disease that is more common worldwide, which is called sudden sensorineural hearing loss, the symptoms very much are similar to sudden sensorineural hearing loss. And just to review what sudden sensorineural hearing loss is, it's a sudden onset of sensorineural hearing loss developing over 72 hours or less. Worldwide, the prevalence is about 5 to 30 patients per 100,000 population. And just in the United States, there's usually about 60,000 new cases per year. The disease is usually unilateral. The cause is unknown in most cases, but theory is it might be infectious, circulatory, immunologic. Treatment for sudden sensorineural hearing loss is corticosteroids, and with or without treatment, up to about 70% will improve to some extent. And the reason why we don't know more about this disease is that we do not have a good animal model. So now going back to the Lassa fever. So this Lassa fever actually had a mouse model, which is located in our Galveston National Lab. And the reason why I got involved is because of this Galveston National Lab at UTMB, we have an abundance of all sorts of different tropical diseases and infectious diseases that are on campus. And because this model had hearing loss, I was asked to participate in the study, and that's how I got involved around 2014. So it's almost 10 years since I started this project. So let me show introduce a little bit about the Lassa fever model mice. So the baseline background mice that we use is a STAT1 deficient mouse, a knockout mouse, and we infect them with intraperitoneal injection of the Lassa virus that was isolated from human subjects. And interestingly, this model really reproduces many symptoms and signs that are seen in human patients. And so it is one of the really good models to use to study this disease. And more interestingly to us is that 100% of these mice develop severe hearing loss after they clear the acute phase of the infection. And the reason why they found out that these mice had deafness is actually really just by chance. The postdoc who was working on this project went overseas to go back to their country for vacation, and they left the mice alone. Usually these mice are euthanized after about 2 weeks because of the disease, but they didn't have time, and the mice were left alone for about 2 months. And when the postdoc came back, she realized that they're circling, they're head bobbing, and then they were also deaf. And so that's how they found out that, oh, these mice are also deaf. And that's how the research started on the hearing loss. And the comparison of human symptoms and the STAT1 knockout mice, as I mentioned earlier, they do reproduce most of the key symptoms that the humans develop: fever, hemorrhage, weight loss, hepatitis. And in terms of the hearing loss, pretty much the same. They develop hearing loss after the acute phase. And one thing that might be a little different is that most of these mice develop bilateral hearing loss versus unilateral in the, the humans can be unilateral or bilateral, but most of the mice develop bilateral hearing loss. And histology-wise, we do know that most of the damage is in the spiral ganglion and the auditory nerve, which I will be showing in following slides. So then why would we want to study a hearing loss in Lassa fever that we don't even see in the United States or in any other part of the world? For one, as you can see, this is a really novel model of a viral infection-induced hearing loss. And number two, because of its similarity to sudden sensorineural hearing loss, maybe we will unveil some of the mechanisms that are common between the two diseases. So we set up a pilot study. So this is just to establish the model of the hearing loss itself induced by Lassa virus. We used 2 different types of mice to infect. One of them is the STAT1 knockout mice. And this is sort of a partial immune response model. And then the other one was the interferon alpha beta gamma receptor knockout mice. So knocking out everything, this mouse has no immune response whatsoever. We did a preliminary auditory test before we put them in the ABSL4, animal BSL4 environment, the lab. And they are infected intraperitoneally with the human virus. And then during day 0 through day 60, they will have serial auditory tests. And then at day 60, 2 months after infection, euthanize and do histology and find out what is going on in the inner ear as well as the whole body. And for our initial pilot study, we used the auditory startle reflex. And the reason why we use this is because this was available in the BSL4 already. So this is a kind of a rough estimate of hearing loss, very similar to what we do, like a hand clap prior reflex. And we measure the whole body movement to see if the mouse startles when it hears the sound stimulus. And as you can see in the STAT1 knockout mice, after about day 29, day 45, day 59, their response is diminished. Comparing to the interferon alpha, beta, gamma, the response is still there, meaning that they do not have hearing loss versus the STAT1 has hearing loss. We then went ahead and looked at the histology of the inner ear. And in our case, we are kind of limited to doing histological analysis. And the reason why this happens is because when you're in BSL-4, you're handling a very highly contagious virus agent. And so it cannot come out of the BSL-4 environment easily, which means that usually they will be put in 10% formalin for at least 1 week before they can come out. And also dissection within the BSL-4 before coming out is very difficult with all the suiting and the gloves that the experimenter wears. And so we did a paraffin section, thin section, to look at the structures of the inner ear. And this is just an H&E comparing the STAT1 and the interferon alpha, beta, gamma knockout mice. Just to give you an orientation of the structure of the cochlear duct, we see the organ of Corti here, tectorial membrane, stria vascularis, spiral ganglion, scala, tympani, cochlear nerve, facial nerve, and you also see a little bit of saccular macula here. But anyway, what we found in the mice is that in the interferon alpha, beta, gamma receptor knockout, most of the structure is normal. You can see that you have a lot of cells in the spiral ganglion. The cochlear cells look healthy. Facial nerve also looks healthy. No infiltration within any of the scalas. But on the other hand, if you look at the STAT1 knockout, the spiral ganglion cells, there's a lot of vacuoles, degeneration. Also in the cochlear nerve, you see a lot of these little black dots. They're actually lymphocytes that are infiltrated within the perilymph area. But interestingly, the organ of Corti and the hair cells seem to be preserved most of the time. Oops. We then went ahead and stained the sections with Lassa virus antibody. And within the cochlear duct, we saw that the Lassa virus is in the spiral limbus here, also in the stria vascularis. And we see the same in the interferon alpha, beta, gamma mice around the same area, which means that the interferon alpha, beta, gamma mice also have Lassa virus, but they just cannot clear it. But they also do not have any immunologic response to the virus either. And so that's why they're not having any hearing loss at this point. Oops. Oh, I think I skipped one slide. And this is where we stain the sections with CD3 antibody, which is a pan T cell marker. And as you can see, the T cells are abundant in the perilymph area in the Lassa STAT1 knockout mice, especially in the scala tympani and within the nervous tissues. As opposed to if you look at the interferon alpha, beta, gamma mice, you don't see any of that immunologic reaction. So to summarize our pilot study, we were pleased that the Lassa fever model mice reproduces human Lassa fever symptoms, including hearing loss. Pathologic changes in the inner ear were damage to the cochlear and vestibular nerve, and hemorrhagic changes in vascular-rich tissue. And surprisingly, the sensory hair cells were intact. Nerve damage looks like it was selective to the 8th cranial nerve and did not affect the 7th cranial nerve. Lassa virus and CD3 positive T cell lymphocytes were observed in the same area of the damage. And so we conclude that auditory dysfunction correlated with the nerve damage. And also this nerve damage needs immunologic responses to induce hearing loss. So then we went ahead and did some more experiments to find out the details of the immunologic response. So we used the STAT1 knockout mice, but this time we used a monoclonal antibody against CD4 or CD8 or both together to deplete CD4, CD8, just CD4. Just CD8, and then a mock antibody that does not deplete anything. We infected these mice with Lassa virus or as a control with PBS. The same, we did auditory testing before inducing them into the ABSL4 environment. After infection, we did a serial timeline auditory testing, euthanized the mice at day 98, about 3 months after infection, and then went ahead and did histology. This time around, we decided to do a more detailed auditory testing to find out if we can know more about the details of the hearing loss. Some of the tests that are used popularly in mouse models, we use the ABR, auditory brainstem response, and also DPOAE. And by the way, having these two auditory testing functions within the ABSL4 and using them in mice is a first in the world. So we're very proud of that. And after we did all of the testing and euthanized the mice, again, we did paraffin sections as we did previously, but also we are working on looking more into the 3D structure of the temporal bone using tissue clearing. So what happens when you delete anti-CD4, CD8, CD4, and CD8 separately? First, you will see weight change. It's a little hard to see, but this is days after infection. So it says 40, 60, 80, and 100. But in the early days, most of the mice have a temporary weight loss. This is when they get infected with the disease, but afterwards, if you're a healthy mouse, you will clear the infection. So as you can see, if you deplete both CD4 and CD8, the mice are pretty healthy all the way to the end. But these ones, especially the isotype control is a mouse that is not depleted with either. You can see that the mouse has pretty bad disease all throughout. Also with the anti-CD4, you see a lot of weight change here. Also, you will see a temporary body temperature change within the acute phase. And if you can look at the survival rate for the anti-CD4, the survival is about 40% as compared to all the other mice. They are 100%. So what we conclude from this is that it seems that CD4 depletion is associated with severe acute Lassa disease. On the other hand, if you look at the ABR and DPOAE, the auditory function, the two different strains that have hearing loss are the green and the purple, which is the CD8 depletion model, and also the isotype control, which is a mock control. And so if you go back to this, for survival, CD4 depletion is critical. But then for hearing loss, it seems like CD8 depletion is critical. So they have two different mechanisms going on. And moving to the histology, let me take you through the anatomy a little bit again. So this is the organ of Corti, stria, spiral ganglion, cochlear nerve, stria vascularis. This is the model that is infected with PBS, so it's a control. You don't really see anything going on. It's supposed to be the normal control. But once you infect the Lassa virus to a CD8 depleted mouse, you have severe disease as shown in here, especially in the scala tympani. You see all of the lymphocyte infiltration and fibrosis already forming. The spiral ganglion cells are pretty much vacuolized and degenerated. Also, you see a lot of hemorrhage within the cochlear nerve. But when you deplete both CD4 and CD8, pretty much everything is normal. If you deplete CD4, this is, to remind you, which has acute disease. The survivors do not really have any change in the inner ear. And then the isotype control is the one without any CD4 or CD8 depletion. This also has severe disease. When we look at where the Lassa virus exists within these models, as you can see, the Lassa virus is in the spiral ganglion, scala tympani, and the perilymph area, which is pretty much the same as what we saw with the previous models. And also at the same time, we see a lot of CD3 T cells within that same region. So next, I want to take you to introduce you to some interesting histology studies that we have been doing. So using the tissue clearing, we are able to see the whole temporal bone without doing extra work, putting them in paraffin and thin sectioning. And sometimes you can even lose tissue. And so it's beneficial if you can just see the entire temporal bone without processing for histology. And this is just a wild type normal mouse that I'm showing you here. You can see the cochlea, you can see the vestibular tissue. This is the anterior crista, lateral crista, utricle, saccule. So if you're able to do the clearing, there's possibility that you can see whether the damage from the virus has any tonotopical differences. And so this is one of the newest experiments that we've been doing. So this is one of our mice that was infected with PBS. So this is a control. And let me show you what it looks like. You can see the rows of hair cells stained with the myosin 6 antibody. The red is phalloidine, F-actine, looking at the blood vessels, stereovascularis. But you can clearly see the 3 rows of outer hair cells, and you can see that they're beautifully spiraling all the way from the apex to the basal turn. So this is just a still image to show you that it's pretty possible to look at the individual structures. We haven't gotten to staining some of the spiral ganglions or the neuronal cells yet, but that will be the next step for us. And this is an example of one of the mice that were infected with Lassa virus. And this one died at 10 days after infection. And we were not able to measure hearing loss or anything for this mouse, but you can see that in the acute phase, the hair cells are pretty much normal and looks like the structure is normal overall. And this is another mouse that is affected with the Lassa virus at 3 months after infection. When we measured the auditory function on these, we know that these are deaf. But as you can see, the hair cells are pretty much, they look normal all throughout. And this is another example of a mouse that is deaf. It has no response with ABR or DPOAE. And this is the left ear and this is the right ear of the same mouse. And I just thought we would present this to you as a comparison. But you can see that the organ of Corti in this mouse seems pretty much normal, whereas the neuronal structures, spiral ganglion, cochlear nerve, and everything neuronal is pretty much destroyed, and you see a lot of infiltration of the T cells. So to summarize our second study, we found that CD4 depletion was associated with acute severe Lassa disease itself, while CD8 depletion was associated with later onset hearing loss. And the pathological changes we saw were damage to the cochlear nerve, hemorrhagic changes in vascular rich tissue, endolymphatic hydrops, edema and fibrosis, and infiltration of lymphocytes in the perilymph. And surprisingly, again, the sensory hair cells were mostly intact, even when they had severe hearing loss. And the Lassa virus and also the CD3 positive lymphocytes were seen in the same area of the damage. And hearing loss in CD8 depleted mice, but not in CD4 CD8 depleted mice, suggests that immunologic response is necessary for Lassa virus infection-induced hearing loss. So what are the next steps? So we want to really compare findings in the mice with the humans to see if indeed they share the same mechanisms. So this is where our collaboration with the Jos University in Nigeria come in place. And we have set up a cohort study studying the natural history of the Lassa fever-induced hearing loss in newly infected patients, as well as studying the auditory performance in hearing aiding cochlear implant users. And we hypothesized that the nerve damage will result in poorer word recognition and hearing performance in these individuals. And it's interesting because when you ask our collaborators in Nigeria, they will say, yes, we see so many people with hearing loss in the community. And at first we weren't really sure what that meant, but it turns out that every person I ask about whether there's a lot of hearing loss in the out in the field, and every person does respond that. So I think it is true. And what do we know about humans who have Lassa fever? So the Lassa virus seropositive rate in West Africa is about 9% in the general population. And in Nigeria alone, it's about 20% or higher. Liberia is reported to be about 4 to 40% in hospital staff, Sierra Leone up to about 50% in the general population. And there was an initial pilot hearing loss cohort study, which was done during the 1980s and 90s in Sierra Leone. According to their data, they reported that about 30% of the Lassa fever patients develop hearing loss. And interestingly, those who already have sudden hearing loss, in about 80% of them are seropositive for the Lassa virus. And just to show you our collaborators at Jos University Teaching Hospital, Jos is located in central Nigeria, right here. As everyone knows, Nigeria is the largest economy in Africa, and beneficial to us is that the official language is English. Jos is the capital of the Plateau State, and the population is about 900,000, which is 6th in Nigeria. Jos University Teaching Hospital is unique in that it has a pretty robust department of otolaryngology. They see up to about 250 patients per year with hearing loss. They fit a lot of patients with hearing aids. They also have a cochlear implant program in collaboration with some of the private practice people in Florida. And they hold 5 faculty members, 9 residents, audiologists, and currently they are trying to set up a cochlear implant training center for West Africa in this facility. So I think it's a very good opportunity for us to collaborate and see what the infrastructure, and also I see more research coming in through our collaboration. So just to give you an idea of how much hearing loss is prevalent in this area, this is the global prevalence of hearing loss in different ages. And as you can see, once you hit 60, there is a rapid rise in the prevalence of hearing loss, which is moderate or higher grade, which will affect your everyday life. But before 60, there is hardly any hearing loss in the general population. Now, if you compare that to people who visit the ENT department at Jos University, the baseline is about 28 to 24%, which is already about 10 times more than the general population in the world. And then once you hit 60, the trend is similar, but you can see that a lot of people really do have hearing loss. And to make things worse, there was a pretty big outbreak in 2018, which was actually good for our study because we were able to recruit some patients from this outbreak. And this is the plan for our cohort study. We will be looking at two different populations, those who have confirmed Lassa virus infection and those that have hearing loss and don't know about Lassa virus infection initially. So for the Lassa virus infection group, we recruited or have new onset Lassa fever patients that were admitted to the hospital with acute disease. Our plan is to follow up on their hearing in serial times after infection to see what the prevalence is, the onset is, degree is, and natural history of the hearing loss. Also, we will recruit patients who know that are Lassa fever survivors, and also do a questionnaire and figure out what their prevalence and onset is. In group 2, these are the people who already have hearing loss, but we don't know whether they've had Lassa virus infection or not. So we will be collecting blood to see if they have Lassa virus titers. And this might help us with some of the pathology, confirming the pathology by doing detailed audiograms and physical examination of the inner ear. So we'll do a chart review, history and physical examination, and then all sorts of auditory function tests. And we have been able to recruit our goals so far, but as you know, as everyone knows, the study has been interrupted by the COVID pandemic, and we are a little behind, but we are now starting to do the human analysis. And this is just a preliminary result that I want to present today. The group 1 is the new onset Lassa fever. We have about 22 subjects recruited so far. And the good thing is everyone has normal hearing at onset. And so we are hopeful that we will be able to capture when these people start having hearing loss. There are 14 people that have known Lassa fever, history of Lassa fever. And indeed, in this group, about 70% have moderate or worse hearing loss. And per the questionnaire, they mentioned that the onset of hearing loss is around 3 months to 1 year after the onset of Lassa fever or Lassa fever infection. We also went ahead and looked at the antibody titer of the hearing aid users, these people in group 2A. And the Lassa virus positivity rate in this population is very high, and they are up to half of the people who are using hearing aids. But more strikingly, the people who are cochlear implant users, we have about 6 of them, 80% are positive for Lassa virus titers. Whereas if you just randomly collect blood samples from the same region, the positivity rate is about 70%. This is still high, but much lower than the people who have hearing loss. So we do think that there is probably a correlation between Lassa virus infection and severe hearing loss. So that's all we have so far, but for future directions, we would like to look, we'll complete the cohort study to see and find out more details about the human disease. We also are interested in looking at, is there any method for hearing loss prevention, treatment? We can look into steroid injection. Does ribavirin prevent hearing loss? There's actually, I think it was a case report about a person taking ribavirin, but still develop hearing loss. So we already know that ribavirin does not prevent patients from hearing loss, but that is a fact. And then are there any new drugs that are on the market that we can use? How about hyperbaric oxygen treatment with the temporal bone lab? Can we look into some cadaver temporal bones? Also, as I mentioned earlier, that these mice, our mice, had head bobbing and symptoms that are suggestive of the vestibular system dysfunction also caused by Lassa virus. So we are looking into doing some vestibular studies. And we do see some Lassa fever patients in the humans that also have balance dysfunction. So this is also, of course, an interest of mine that we want to pursue. And these are histology studies from our first pilot study. We did look into some of the vestibular tissue. Same with the cochlear tissue. We do see a lot of hemorrhage and destruction near the neuronal structures, but not necessarily the hair cells. And the last antibody is we mainly saw in the stroma of the saccule and the utricle. And the same area is infiltrated with CD3 positive lymphocytes. So these are very preliminary data that we will be pursuing in the future. So in conclusion, Lassa virus infection causes hearing loss in humans and mice after the acute phase. CD4 T cells play an important role in Lassa virus infection-induced hearing loss. CD8 T cells are critical for pathogenicity in the acute phase of Lassa infection. There's a high prevalence of hearing loss in West African countries where Lassa fever is endemic. And the prevalence of the Lassa virus antibody positivity rate is extremely high. And so we do think there's a high correlation between the Lassa virus infection and the hearing loss. And these are the people who participated and helped with the project. Dr. Passler's lab did all of the BSL-4 and actual animal experiments. The team in Jos, Nigeria, they collected all of the human subjects data. And then our lab did the histology. And that's all. Thank you very much.
Well, thank you, Tomoko. This is really impressive and going from mouse to human, and looking also at the interactions with the immune system and a lot of new systems. There are quite a few questions in the chat box. I'll read them to you.
Okay.
The first one is from Ed Monsell about what is current about the concern that a vaccine could cause hearing loss.
Yes, so that is an excellent question. And so I think that is a big possibility. And because this disease, although it's pretty prevalent and it does cause hearing loss, it does not cause a lot of death, probably about the same as COVID. And so we're a little skeptical about the need of developing a vaccine, especially if it will cause hearing loss. And I think that's a big possibility just based on our animal studies.
The next one is from Kelly Rivas. What is the probability of Lassa virus reinfection?
Lassa virus what?
Reinfection.
Reinfection. Okay. So we don't know. Yeah, simply we don't know. The infrastructure for medical care in that region is very skittish. And I don't think we have enough data for that, but hopefully we can, if we get funding and are able to expand some of the human studies, we'll know more.
Matt Ingersoll is asking, he says, wonderful presentation. And do you think that the loss of hearing is primarily due to the damage from the virus itself or from the immune response to the virus?
So we think it's both. So in the acute phase, our theory is that in the acute phase, the virus probably attacks something within the inner ear. And that probably is exposing some sort of antigen that after you develop antibodies to it in the convalescent phase, then now that is attacking your inner ear, probably not the hair cells, but somewhere near the spiral ganglion and neuronal structures.
Okay.
So I think you probably need both. Yes.
And Jean-Francois Lafond is saying a fascinating presentation. Thank you so much. Is there afferent nerve fiber loss in the organ of Corti? And he says that at one point in your presentation, under the macula, there seems to have been an afferent nerve fiber loss.
Yes, that is correct. But again, we haven't looked into the specific neuron population yet, and that would be the next step for us. We just merely stained with like hair cell markers and things that will work. We have to remember that because these specimens are heavily fixed before they come out of the BSL-4, there's a lot of limitation on what antibodies we can use to mark, use as a marker. And technically it's very difficult, but we'll get to that.
Kathy Sung is saying, thank you for this great presentation. The data seem to indicate that CD8 T cells are important. Are important for later onset hearing loss, but mice that were neutralized of both CD4 and CD8 T cells did not develop hearing loss.
Mm-hmm.
Could you comment on what you think the mechanism is in CD4 and CD8 T cell neutralized mice that spares mice from hearing loss, while CD8 T cell neutralized mice do have hearing loss?
Yeah, so when you deplete both CD4 helper and CD8 killer T cells, they will not have a robust immune response. And so it is clear that you do need immune response for the hearing loss. And when you deplete the CD8 T cells, which means that the killer cells are not present, that's when you start having hearing loss. And so the helper cells are more of what is triggering probably the hearing loss.
So she has a follow-up question. In your mouse study, you have used STAT1 and interferon alpha beta deficient mice. Have you considered using a wild type mouse strain for infection to determine the level of hearing loss? Could you consider a mouse strain with reduced NK cell response like the BALB/c?
Yeah, so that's an excellent question. And the reason why we can't use the wild type mice is that most of the wild type strains are immune to infection. So they get infected, they have viremia for about 2 to 3 days, but then after that they clear it. They never develop acute disease, they never develop hearing loss. And so that's why traditionally for viral infection models, they use STAT1 or interferon alpha or whatever. And those are the 2 strains that we had here in the lab, and we just tested the 2, and we found out that STAT1 was suitable for our model, and so we didn't look further. But I think that is an excellent question. The BALB/c probably will be an interesting model because I think there are other groups that actually do that.
I think that these are all of our questions.
Okay.
But I think we'll all thank Tomoko again for a great presentation. And if you have additional questions, you can reach out directly by email.
Thank you very much.
Thank you. Beautiful work.
Well, thank you. Oh, there's some.
They're saying thank you.
Oh, okay, okay. Everyone's so kind.
A huge body of work.
Yeah, because it's worth of, like, as I said, we started in 2014. It's almost 10 years.
It's really hard.
Yeah.
No, this is beautiful. I'll see you soon.
Okay. Thank you very much, everyone.